I just have to make the comment that my presentation is really quite high level. So it's not a detailed research paper. It looks generally at the future of how digital health is going to impact on nutrition and healthy aging. So if you can see my screen, I'll carry on with my presentation. As I mentioned, my name is David Wortley. I am the Vice President of the International Society for Digital Medicine. Perhaps Vincenzo could mute himself because I can hear him in the background. Vincenzo, can you mute yourself and switch off your screen so I can still see you and hear? Thank you very much. Okay, so I will carry on with my presentation. I'm a Vice President of the International Society of Digital Medicine, which was founded in Nanjing in China in 2016. My background isn't in medicine, my background is in technology. So my main interest is in how future technologies are likely to play out when it comes to digital health, and in particular, healthy aging. So that is me. And to begin my presentation, I just want to set a context and a background to the presentation and look at the drivers and the factors which make preventative healthcare, and in particular nutrition and exercise, extremely important in the future of sustainable public health services. The principal background to all of this is the fact that over the last century, our life expectancy has increased enormously. And if you look at this graph of US life expectancy between 1900 and 2019, it's gone up from 48 years at the end of the last century, 1900, to around about 80 years old now. And with this increased life expectancy, we have the main problem that as we get older and get past retirement age, we tend to need more care. And that care has to be provided by a dwindling number of clinical professionals. And if you want to represent it in a graphical format, at the end of the Second World War, around about 1945, we were in a happy position of having over 40 working people to each retired person. And over the last half century, this has gradually dwindled and dwindled to the fact now that we have less than 3 people working, and this working population has to support and generate the income to be able to look after the elderly population. And also, if we look at the factors which are causes of mortality today compared to 1990, we can see that there's been a rapid increase in non-communicable diseases, or NCDs, where there's been a decline in communicable diseases. This is distorted at the moment, of course, with COVID-19, but still, it doesn't alter the fact that the major causes of death today are not communicable diseases. They're non-communicable diseases and injuries, which by and large are preventable. So this graph here shows that some of the leading causes of death between 1990 and 2019, and we can see that cardiovascular diseases, other kinds of diseases, and cancer, which are all related to lifestyle activities, are the primary causes of death. So we have a problem, and we call it the aging society. And this problem manifests itself in a number of different ways. As people get older, they tend to need more medical care, and that's exacerbated by our current lifestyle, by smoking, by our diet, in particular by our lack of exercise, resulting in needing more clinical care, and also problems with mental health related to social isolation. I know this from my personal experiences. My mother, a picture of her as she was in a hospital after she suffered from dementia, but in the care home she was looking after, she wasn't properly hydrated, and consequently, she finished up going unconscious. And fortunately, they were able to care for her in hospital well enough for her to be able to be discharged and sent home. So these are the main kinds of challenges. We've got fewer and fewer people to cover the costs of healthcare as we get older. And in the UK, certainly, social care or care of the elderly is a poor relation of public health services. So much money goes into tackling coronavirus, clearing the backlog of hospital operations and a whole range of things, that the money that goes into care homes is insufficient to properly care for older people. And coronavirus has only exposed our vulnerability to the unsustainability of public health care. So we're looking at solutions globally, and this is the lead in to where nutrition comes into this. We have a number of choices. We can seek to solve problems by developing vaccines and drugs, as we have done for coronavirus. We can adopt legislation, things like social distancing, wearing masks, working from home. All of these have been legislations that have been brought into the UK to try and stop the spread of a communicable disease. And the third thing that we can do is to adopt better personal health management strategies and to accept more responsibility for our own health. Unfortunately, technology has something of a paradoxical effect. On the one hand, we are tempted to think that technology can solve all of our problems eventually. We will find a cure via technology and some of the developments within machine learning and big data analytics that will, so we can carry on living the way that we are, and we'll have these problems sorted by technology. On the other hand, we could take a different approach and say that technology is a fantastic tool because it's very empowering and it can help us to manage our own health better and give us a chance to live a longer and healthier life. And in younger people, this paradoxical effect of technology has led to the idea that we are now so dependent on technology that we no longer have control over our future. And so we suffer from what's known as an external locus of control, is that things happen to us. We are not able to make things happen ourselves. This is a very worrying trend amongst the younger generation. So how do we make this necessary transition from curing diseases to prevention? If lifestyle-related diseases are the primary cause of death, the best thing we can do is to change those lifestyle behaviors that have an impact on our health. And how do we do it? How do we do it at an individual level, but also at scale? And this is where technology comes in. And we have a number of mobile applications. I'll very quickly go through a little bit of my experience and background in all of this. Some 8 or 9 years ago, I myself was morbidly obese. I didn't suffer from any particular health problems, but I became conscious of the fact that I got a higher probability of getting diabetes too. And with my background in serious games and gamification and technology, I looked to find ways in which I could better manage my own personal health. And so I started with a mobile application that you see on the left-hand side, linked to a wearable device called the Jawbone Up, which measured my sleep, it measured my number of steps every day, and it also measured and gave me a ranking on my diet. Now, to begin with, I concentrated on doing 10,000 steps every day. And in fact, over the last 8 or 9 years, I've walked 5 miles almost every day and continued to do so. But it was the diet aspect of my lifestyle that I discovered were, if anything, more important than my physical exercise. Now you can see this approach paid dividends, because in the space of 3 months between May. I know September is more than 3 months away, but within 3 months after using wearable devices and monitoring my physical activity, my sleep and my diet, I had lost 21 kilos. And so I could see for myself how you can make major improvements in your physical and mental health if you apply technology in the right way. And I describe it as a personalized, gamified, and validated behavioral change strategy. It's not a one-size-fits all. It has to be a strategy which is linked to the individual circumstances and personality of the person. So the key health and well-being influencers that we can do something about are diet, nutrition, obviously, exercise, hydration, sleep, mindfulness, and stress management, and very importantly, a background of social support that will help you to comply with whatever health regime you are adopting. So how do we achieve this with technology? Well, there are a number of steps involved in this. First of all, we need to measure the key influences to our personal health. All of the things I showed on the previous slide, our nutrition, our exercise, our sleep, our stress, etc. We need to be able to measure those, and we need to be able to create personalized benchmarks that are appropriate to us. So what is our current state? What's our weight? What can we achieve? So we then set achievable goals, which is exactly what I did. And these goals have to be within the capabilities of the individual. Otherwise, you will not motivate people, you will demotivate them. And you need to provide a supporting environment. Now, normally this is your lifestyle circumstances, your home environment. So it's a supporting environment, but it also is a supporting environment that is linked to technology. We can these days also use digital therapies, and I'll come on to that towards the end of my presentation. And all of this is designed to encouraging us to take personal responsibility for our own health management. So I'm going to look at the way technology has evolved and the types of applications that are available today. One of the devices that I use, and I use more than one, is Fitbit, which I'm sure most people will be familiar with. And Fitbit primarily encourages and helps to track our exercise. It records our sleep, but also calculates the macronutrients and calorific intake from our food. But we have to enter this manually. And it offers recipe suggestions. So if you look at the dashboard that's provided with Fitbit, and you look at it, the diet and nutrition elements of it, you can see on the left-hand side, you can see this is my overall dashboard. And it was a dashboard taken from Wednesday, the 2nd of February, so it's quite recent. On the left-hand side, it shows things like my resting pulse rate, how many days I've done my 10,000 steps so far, how much water that I've had, and also my calorific intake. And that calorific intake is calculated from what I put in from my diet. So all of the things that you see in the middle slide, chicken and leek pie, mashed potatoes, carrots, etc., I've had to enter these manually, and Fitbit calculates then the calorie value and calorie targets, and it provides you with some examples of good, healthy diet. So it's providing a little bit of advice and a few hints, but it's not meant to be prescriptive, and it is not a medical application. So they're trying to clearly, with a lot of mobile applications, avoid any possibility of litigation by providing advice which is inappropriate to the individual. Now, the second generation of applications which are related to diet and nutrition, an example of this is an application called Moodoo, and it uses epigenetics. The way that it works is that you take a sample of your sputum, you send this off to a laboratory. You load a mobile application, and when you get the results back, what Moodoo does is creates a personal profile based on your DNA. And from that, it can help to calculate a personalized optimal diet and exercise plan. And so it's a bit more precise and it's a bit more personalized than Fitbit. This is why I call it a second generation app. And here are a few screenshots that from Moodoo that shows the DNA results. It says on the left-hand side, it says I have a normal response to carbohydrates, and it shows how my DNA or how my body responds to different types of food. So sugar response, I've got an increased response to sugar. I have a moderate liability for snacking risk. I have a normal lactose persistence. So it's personalizing all of this based on my DNA, and it's giving me some health insights. Sadly for me, it shows that I have a slightly higher risk of a physical decline with age. But my testosterone is going to have a slower decline, and so on. You can see on the right-hand side of the screen how my body responds to different things as I get older. I'm also glad to say that it measures my biological age compared to my physical age. And fortunately, my biological age is about 3 or 4 years younger than my physical age. So it's creating much more detailed analysis, and it's given me an opportunity to set my own targets by choosing what my goal will be. And am I keen on losing weight? Am I keen on developing my fitness and endurance, or my health and well-being, etc.? So it sets health and well-being targets, and it translates the epigenetics to effectively a personalized dietary plan. And it, like Fitbit, it gives you some examples of recipes. So it's much more personalized than Fitbit. Before I move on to the third generation types of applications, I just want to highlight a particular challenge. Again, it's personal experience. My partner's father, called Eric Jepson, he passed away last October. He lived with us for a period of 12 months because he became unable to look after himself. Not because he suffered from dementia, his mind was always alert, but he had multiple drugs to keep the quality of his life. You can see the quantity of drugs that he had to take before he went into his end-of-life daily drug routine. And all of these drugs had to be put together by my partner every single day. So we've got into a situation with our society of this comorbidity. And with every new drug that is prescribed and every combination of drugs, there's always a risk of drugs clashing with each other and not being compatible with the individual. So this is why I think diet and nutrition is extremely important. So the final example I'm going to show you is what I call a third generation application. It's a proof of concept at this stage. It doesn't actually exist, but it uses epigenetics, and in the same way as Moodoo, it creates a profile based on our DNA, but it also factors in the medication that we are taking, and again, calculates the optimal diet and nutrition, and it goes further because it provides real-time personal advice when we're shopping and when we're trying to find the goods we want to eat. And so this is exemplified by this proof of concept, this character called Albert. It's a fictitious character. This Albert has multiple medical conditions. He takes a number of drugs. So what we're interested in is how we can design and develop an optimal diet for Albert and help him to comply with that diet. So this is how it works. This is a proof of concept called the Diet Advisor. And it looks at the interactions, drug-to-drug interactions, drug disease, drug to ingredients of food, allogenetic reactions, and pharmacogenetic. And it uses all of this to decide what kinds of food and what nutrition is going to work best for Albert. And it uses this then to create a mobile application that Albert can use when he's out shopping, shopping in Tesco. And when he looks at choosing individual items, it can give him advice and gives him thumbs up or thumbs down. And if he's got something with thumbs down, it will tell him to avoid it, but it will provide an alternative. So what we are likely to see in the future in applications that do this. So in my view, we're going to see more and more personalized diet and nutrition based on epigenetics, not just epigenetics, but medication. We'll see the use of AI and machine learning to recognize both purchased food and cooked food and calculate the nutritional value instead of you having to key it in. It will provide it will encourage personalized food delivery services for both ingredients, if you want to cook your own foods, and pre-cooked meals like Meals on Wheels. And it will also link to various biometric wearable devices or embedded devices that link from these devices to provide feedback to show the effectiveness of whatever regime is. So this is a kind of ecosystem that will create opportunities for us to better manage our own personal health. Now, I've got a set of slides which then look at digital therapeutics that are not more linked to physical and mental well-being. I'm going to just run through those extremely quickly, just to make the point that nowadays we have technology like virtual reality and these devices which help to influence our behavior, but not only influence our behavior, they can also act as providing therapy as alternative to drugs. And virtual reality is an example of that. So these are a few quick screens showing an example of a physical exercise application for rehabilitation. This is how you can use a virtual reality headset to be able to gamified exercises that allow you to effectively use devices like you'll see on the screen there, which can be used as a desktop device, which you use pedal with your hands, or it can be put on the floor and you can pedal with your feet and travel through a real world or virtual environment based on a real world. Digital therapeutics, reminiscence therapy, you can provide with virtual reality, the kinds of environments that have got created here. This is the kind of Harry Potter environment. This is the living room in my house, which I've turned into a virtual environment, linked to
the Magic Family Tree displays when you roll over this area.
Virtual reality videos that allow families to be able to capture, store, and replay memories of their lives. One of my favorite applications is called Alcove VR, which again is another personalized environment that allows you to invite people to your own personalized environment where you can share your own life experiences and virtual reality images and videos. So digital therapeutics do provide physical and mental health solutions, but for the older population, they need to be plug and play. They need to provide realistic challenges, personalized challenges with fun. They need to also engage the family and the community and provide feedback and diagnostics to both motivate and track your health, and primarily need to give users control over their own health. And finally, this is my last slide before I conclude, is that we need to change our thinking about older people. We need to think of older people not as a cost burden on society, which is the most common perception, I believe. We need to see elderly people as an asset, and we need to use their resources, their expertise, their life skills to the benefit of society. And we can help them to do that with a healthy diet, healthy nutrition, and the tools and technologies which allow them to do that. So that really concludes my presentation, and I'm now going to stop sharing my slides.